I'm Mata Pogo. My current role is the technical officer for youth and adolescents, but now, performing at a greater capacity as the manager for immunization program in Papua New Guinea. So I'm currently managing the EPI program. Oh, a lot of things. My experience when I was back at the, clinic and at the curative side, I would sit in the health facility and wait and see one person walking in at a time. And that compares to the time of my time being consumed by one person, waiting for one person. And I thought, what if I go to the community and stop the population from coming in? While waiting here and taking the whole day to save one person at a time. Why don't I take 1 hour to save 100 people? That was where, I thought of population and community-based health interventions. That was how I think into public health. In terms of my current capacity, it's about immunization, it's about, preventing the vaccine-preventable disease. So it's about children, it's about family, and it's about maternal and child health. And having one vaccine-preventable disease saves a lot of lives, a lot of time. You imagine a mother carrying a sick baby to the clinic with measles, which is supposed to be preventable by just one measles vaccine. So this is where I feel, I'm satisfied with the work of immunization around family, and yeah. Oh, in Papua New Guinea, and sitting at that chair, a lot of challenges is around funding issues, human resource issues. A lot of times we don't have people to do what they're supposed to do. Those positions are not being filled. All these ones, all the other logistics and internet services, all these ones are, some of the challenges that slows down, hinders some of the things that we're supposed to be doing. And yeah, but otherwise, we have our partners who are very supportive, and our developmental partners, our funding partners, they fund programs and all this, and that keeps us going. In terms of the National Health Department, it's about policy and guidelines, And if you are able to get a guideline or a policy document on certain programs that is supposed to be rolled out, if it's done and finalized in the given time frame, and that policy document is translated in the provinces in terms of implementation, that is the most rewarding feeling. Yeah, especially when you are up there as a manager. Your document or your policy guideline is translated, it's happening, and you see it work. That's the most rewarding thing. Okay, so I was in the 2016 cohort during my training, and the topic I chose, I did a study around, because I was keen, I came from that background around gender-based violence and all that. I took a study on the uptake of post-exposure prophylaxis among sexual violence survivors. That was the study I did for improving the adherence rate for post-exposure prophylaxis. If a survivor comes to the clinic after experiencing rape, we commence them on the post-exposure prophylaxis, but the uptake seems to be very low. People don't tend to complete, because we know they are not sick, they're healthy, they're perfect, they just encountered an experience. And for a person not to be sick, to be on a treatment for 28 days, is very difficult. So my study was around how do we improve that to prevent transmission of HIV for someone who is not asking for the infection. It just happened. So my study was around that, yeah. Yeah, so during my study, we found out, I did a study at the Family Support Center at Port Moresby General Hospital, and the uptake rate before my intervention was about 21%. And after the interventions, my interventions, it went up to 75% from 21%. So the intervention activities was like simple things. We subsidized the transport cost. Like if they paid for a transport one way, the clinic would, give them the return fare. And we made phone calls every time for reminding them that their review date is, approaching. And we gave them treatment for side effects for the PEP, post-exposure prophylaxis, to minimize the side effects. So they didn't feel anything and they continued until 28 days because one of the main factor was the side effect of the treatment. So that was managed, and of course increasing family counseling so that family and support people are given the training and they see the importance, their counsel, and they support them and they finish their training. So those were basically the simple things done, but it made a difference and brought the adherence rate to 75%. Why I chose this study, someone would say, oh, that's okay, they can, not to continue, what's the big deal? But for myself, I thought that when someone, I was thinking, if someone is HIV positive, contracting the virus through rape, and becoming positive will be a lifetime. That person will be on ART for life. And government and the health system will have to pay ART for that one person for as long as he or she lives. Why not we beef up this adherence rate and people are adhered to this treatment for 28 days to prevent transmission, and 28 days is over and they are not contracting the virus. So no cost involved for the lifetime. So where is the balance, So that was where I was thinking, so I had to do this study. In terms of making a change, in terms of reading disease patterns, in terms of planning for future in health, we have to understand that this is trends and patterns. And honestly, I've been in this health, so many years, over 10 years before I was trained in the FETP program in 2016. And after that training, I walked out seeing health and understanding health and the disease burdens and the trend of disease in a very different way. I can be able to assess data. I can be able to see the value of data. I'm interested in, what is it, how many, from where, who are the populations affected most, Before I wasn't asking those questions. Now it's an eye-opening. I want to see, look, the resource must go to the most needed if data is analyzed. So it's mind-opening for me. And now in my work here in EPI, I'm able to see the coverage, I'm reading by districts, I'm looking at indicators. Oh, it's so amazing. With this FET background, I can be able to, navigate data. And I'm producing data like, every day update for the EPI program, and it has helped me a lot. And it's not about FET. There's no boundary to FET. When you know about data and importance of data, it crosses boundaries and programs. You can manage and you can talk at different levels. Yeah. And I think one thing also, why I was given this EPI manager is because of my FET trained background. That was one thing that came out when I was, they were negotiating for my appointment. One thing that came out was she's FET trained and she can see the data. She can read data, so that one came out. That's one of the factor I think contributed to me being selected. Yeah.